Hello everyone, my name is Tatiana Chibisova and today I'm going to talk about cranial nerve 5, which is the trigeminal nerve. I'm going to talk about cranial nerve anatomy, its function, nerves pathology, assessment, and its significance for speech-language pathologists. So cranial nerve 5 is the largest cranial nerve that has 3 parts, and it carries both sensory and motor information and has bilateral innervation. So the sensory aspect of the nerve is responsible for the sensation of the face, and the motor aspect of the nerve is responsible for innervation of the muscles of mastication. So starting with the cranial nerve's anatomy, there are central nervous system processes and peripheral nervous system processes. I am going to start with the central nervous system processes. So the nerve's nuclei are located at the brainstem, and there are 3 nuclei that carry sensory information and 1 motor nuclei that carry motor information. So the first nuclei is mesencephalic, that is located at the midbrain, and it is responsible for transmitting information such as proprioception of the face. And this is a sensory nuclei. Next is chief sensory, which is also a sensory nuclei that is located at pons, and it integrates tactile sensation and light touch of the jaw. And the largest nuclei is the spinal trigeminal nucleus that is located at the medulla, and it has 3 parts, the pars oralis, pars caudalis, and pars interpolaris, and it is both sensory and motor, and it transmits pain, touch, temperature, pressure, and proprioception of the whole face. So as the nerve exits the brainstem, it has 2 branches, portia major, which is sensory, and portia minor, which is the motor, and it courses towards the prepontine cistern, the subarachnoid space between pons, and the bony structure of the skull, and it courses towards the Michel's cave, also called trigeminal cave, the space filled with cerebrospinal fluid, where the trigeminal nerve ganglion is located, that houses most sensory cells body axons, that contains most sensory axon cells bodies. And at the Michel's cave, the trigeminal ganglion give rise to 3 branches, the ophthalmic, maxillary, and mandibular. And this is the peripheral nervous system processes. So the ophthalmic branch is the sensory that innervates the 1/3 of the upper face, and it innervates the skin of the skull, forehead, upper eyelid, cornea of the iris, cornea of the eye and iris of the eye, nasal cavities, frontal sinuses, and deep structures like dura mater and some anterior cranial fossa portion. The next branch is maxillary, that innervates the middle part of the face. It innervates the lower eyelid, the skin on the side of the nose, the upper jaw, upper lip, maxillary teeth, the upper teeth, hard palate, mucosa of the buccal lining, meaning the lining of the oral cavity. And the largest branch is the mandibular branch, that carries both sensory and motor components, and the sensory component of this branch innervates the lower third of the face, innervating the lower lip, chin, mouth floor, jaw, anterior to 1/3 of the tongue, ear canal, ear pinna, mandibular teeth, and the gum. And it innervates muscles of mastication like masseter, temporalis, pterygoids, anterior digastric belly, mylohyoid, tensor belli palatini, and one muscle that is not mastication muscle is tensor tympani. So the masseter muscle is located here on the side, and when you clench your teeth, you can see it. This one. And when it contracts, it elevates the jaw. Next muscle is temporalis, that is located on the temporal bone, and it is also acts as the jaw elevator. The pterygoids muscles, there are medial and lateral. The medial elevates the mandible and acts with the conjunction with masseter and temporalis, and the lateral aspect of this muscle is protrudes the mandible, meaning that it brings the jaw backward. So next muscle is the anterior digastric belly, that is located under the chin. It brings the hyoid up and forward when it contracts, and it is important for swallowing phase. Next muscle is mylohyoid. This is the oral cavity floor, which is also acts as the hyoid elevator and brings it forward. Additionally, this muscle acts as the mandible depressor, meaning that it helps to depress mandible. And it is also responsible for elevating the mouth, the floor of the mouth during the first stage when you're swallowing. So it elevates the mouth floor and pushes the bolus deeper to the mouth. Another muscle that mandibular branch innervates is tensor belli palatini, and the main function of this muscle is to open the auditory tube for the aeration of the middle ear, so the pressure in the middle ear is equalized. However, it is also assist the levator belli palatini in elevating the soft palate. However, it is not the main function of this muscle. And tensor tympani, a muscle in the ear that it contracts in response to a loud sound. So now I'm going to talk about nerves pathology. So this function of the nerve 5 is called trigeminal neuralgia, and it has characteristics like sudden severe electric shock, like stabbing pain of the face, of the cheeks or the jaw, and it can occur on both sides but not simultaneously, and attacks can last for a couple of seconds and they repeat quickly, and episodes of pain last for days, weeks or even months, and they tend to disappear for months or even years, and when they return with greater greater pain outcomes. So there are triggers that can actually trigger the pain outcome on the face, that include the vibration or contact with the cheeks. For example, shaving, washing face, applying makeup, or doing massage, brushing teeth, eating, drinking, or even talking and smiling. Exposure to wind or cold water, and pain can be localized or spread to a larger area, and the pain is rarely occur during the nighttime. There are two types of trigeminal neuralgia that The first type is when the 50% of the pain is sudden, shock like stabbing. And the second type is when the more than 50% of the pain is constant, aching, and burning. So the trigeminal neuralgia is not a fatal disorder, but it affects person's life greatly, as the person may avoid daily activities to fear of the painful attacks of the face. And there are multiple diseases that are associated and can cause trigeminal neuralgia. For example, basilar skull fracture, dental trauma, metastatic tumors, aneurysm, lupus, traumatic injuries like laceration or gunshot wounds. The cranial nerve 5 is significant for speech language pathologies because it innervates muscles of mastication and provides sensory information of the jaw and teeth, anterior third of the tongue, and oral cavity lining. And when it is damaged, it can lead to oral phase dysphagia. There are 4 phases of swallowing: oral preparatory, oral transmitory, and pharyngeal and esophageal phase. So the trigeminal nerve 5 is involved in the oral preparatory phase when the bolus is formed, meaning when you are chewing and preparing the bolus to transmit it for oral transmittory phase, and so that bolus can be pushed back to the pharynx and then esophageal tube. Additionally, the sensation of the oral cavity and cheeks, as I said previously, eating, talking, or even brushing teeth can trigger the painful episodes of the cheeks or the jaw, which can also lead to dysphagia, or person may avoid eating, talking, or mimicking. So now I am going to perform a trigeminal nerve assessment. I am going to start with looking at person's face. I'm looking for symmetry. The face looks symmetrical. Now, can you open your jaw, please? Okay, looks symmetrical. Now I am going to assess the sensation of the face. I'm going to use sharp object and soft object to assess the pain and soft touch. Now I'm going to ask you close your eyes, and I'm going to touch your face with a sharp object and soft, and you tell me if it is a sharp or a soft touch, okay?
Okay.
Okay, I'm starting with the ophthalmic branch.
Sharp, 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 sharp.
Okay.
Soft, 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 soft.
Maxillary branch.
Sharp, 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 soft, sharp, soft, sharp, 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 soft, sharp, soft, sharp.
Okay. So the pain and soft touch sensation is present. Now I am going to assess the muscles of the mastication. Can you please clench your teeth? Just teeth, don't move your lips. Okay, relax and clench. Okay. So when the person is clenching teeth, you should feel the masseter muscle that is here. The muscle's tone is good. Okay, I'm going to ask you to do the same to check the temporalis muscle. Okay, I feel the temporalis muscle. Now I'm going to try to close your jaw, and you don't let me to do so, okay? Open your mouth. Okay, I'm going to close it. So the muscle tone is good. And now I'm going to perform the jaw jerk reflex. So if the cranial nerve 5 is damaged, the jaw jerk reflex is hyper present, and when the nerve is not damaged, the jaw jerk reflex is minimally present. Okay, open your mouth a little bit. Okay, I'm going to place my finger on the chin and slightly hit my finger. Okay. Jaw jerk reflex is not hyperreactive.